Hello, welcome to All About Energy Life. Today I am joined with Dr. Kamal. Welcome, Dr. Kamal.
Hey, Saba, great to see you again. So, what are we going to do today?
Oh, today we're going to talk about some really fun things, all about me.
Okay, that's a good topic.
Oh my gosh, I'm a Leo, so
Yeah,
no,
yeah.
really, today I'm so excited to have you on the channel. And it's amazing that we got to connect because I want to talk about your practice that you've recently opened up in May in Cocoa Beach, and then you just did June Daytona Beach. I'm sorry, yeah, Daytona Beach, right?
Yep, yep.
And I'm really excited to talk about my experience and how it was coming into the office and the experience I had with acupuncture. So, really touch on that and then talk a little bit about the body type system.
Okay, sure. So, I just took over my practice of both of my teachers. One was in Cocoa Beach for the last 42 years. There was another one who's been in Daytona Beach for the last 26 years. They asked me to take over their practice. So I started this new company called Affordable Asian Medicine. So we're doing the gambit of Asian medicine, which is acupuncture, electroacupuncture, cupping, moxibustion, plum blossom needle, tuina, bone setting, physio restorative therapy, teaching you guys exercises like we did with the body type system, the nutritional aspects of it. And even I've added ionic rebalancing, which is you got a chance to experience. So there's a lot of different things that we do in-house that I could not do with OHO seminars because that was just over video. So now you get me with hands-on and I can do acupuncture. According to the body type system, we have a whole style of acupuncture that's unique, that is not typical that you will find in acupuncture schools. Now, what do I
I
mean by that? In
well,
acupuncture schools, you learn. Go
Mhm.
ahead.
Oh, well, I wanted to jump in on that
Okay.
actually as well because I have received acupuncture. I've always liked to go to acupuncture, and
Okay.
I've worked with different doctors before I met you. And
Sure.
so I firsthand can say that this is probably the most unique acupuncture style that I have come across,
Yeah.
because it's a completely different approach, I feel. And
Yeah.
I'm sure you'll go into the science of it. But
Yeah.
yes, I definitely agree. This is a totally different type of acupuncture. As soon as I heard that you opened your office, I was like, okay, where are you? 4 hours? No problem.
Right,
And so,
right, right. I was
no,
just so surprised you guys drove all the way up, to Daytona to see me for the first time, and then you guys have been getting a little bit closer, which is in Cocoa Beach. So yeah,
right. Every
thankful
week
for that. Yeah.
I've been coming in. Guys, if you are located in Florida, and let me just tell you what a gem this is because I have lots of experience, like I said, with Chinese acupuncture. And so once I knew you opened up your office, I was like, wait a minute, I'm there. And it's just been amazing. The experience of this different type of acupuncture, the things that I'm going through. I'd love to share my experience, but first, if you can give the science part as to why
Sure.
yours is
Sure.
different.
So just understand it's not a new system.
I
It's
understand.
just something that I'm bringing from the ancient times. So
Hmm.
there's three phases of Chinese medicine. There's ancient Chinese medicine, which was about 8,000 to 6,000 years ago. Then there's classical Chinese medicine right around the third century BC. And then traditional Chinese medicine, which is around 1949 to present. So as I started going back into some of the ancient books, I noticed a particular trend about how they focused on constitution. And so that's how I developed the body type system to bring it forward. So when you met me, we were just going over exercises, nutrition, the four energy alignments, those kind of things. But what I was also teaching other physicians is what type of key points you can use to access certain body types. So we incorporate those type of acupoints. We incorporate certain types of herbal prescriptions in order to couple with the acupoint acupuncture therapy, and I call those therapeutic interventions. So when you're having some sort of imbalance or misalignment, we use some sort of intervention to get you back on course. Acupuncture is a really fast tool to get your body back on course. Now, I just had somebody ask me just recently, somebody referred to me and says, well, what's in the needle? There's nothing in the needle. The needle is just there as a tool to steer your body back on course. So we can use acupuncture or electroacupuncture, which is your favorite,
Not
or
my
we
favorite. Not my favorite. I'm like spitting here.
or we use the herbal medicine, and then we
Mm.
still do the nutritional counseling. So for those people who get a comprehensive exam, we also include other aspects of nutritional counseling so that your body can get back on track really, really fast.
Okay.
So the idea is that what we do here now is just an expanded version of what people have experienced with me with Oriental Holistic Options or OHO seminars. And then now you get the hands-on aspect of me working with you directly and hands-on. So that's just the difference.
While asking you a million questions. I love
Why
it.
exactly?
So, okay, now like can we go a little bit back to the ancient Chinese acupuncture? Okay.
Yeah.
What makes that so different? Because
When
honestly, it is
yeah,
so different, Dr. Kamal.
yeah.
The I'll go, how about this? Let me start with my experience
Okay, sure.
and then we can kind of go over this. So
Sure.
I obviously I'm very intuitive with energy, right? So I can
Yeah.
sense things right away,
Sure.
okay, as
Sure.
it's happening, and I can track it as something's changing, etc. So
Mhm.
what I notice with this form of acupuncture, it is fast, it's precise, and it's all levels. In other words, and physically, I'm experiencing something.
Yeah.
Emotionally, I'm
Yeah.
100% experiencing something.
Yeah.
Spiritually, I mean, all emotionally, spiritual, physical, because what's happening is I can physically see what is energetically happening, but that's just me. I'm not saying somebody would come in and have that
Sure.
experience,
Sure.
but
Sure.
for someone that is understanding energy a little bit more, I'm a little bit more attuned to it. I
Sure.
have to say this was by far the most intense
Yeah.
experience because especially this last session that I had with you, it was
Mhm.
an emotional roller coaster for like 48 hours because there was a release. And so
Right.
when you were working on one needle particular on a certain side of my body and like I got up from the session, of course I was
Mhm.
crying for about half an hour or
Yeah.
so
Yeah.
because I was
Yeah.
releasing emotion, but
Exactly.
the way my body was moving was
Yeah.
so fluid. It was like the left side of my body was completely released and
Yeah.
relaxed. And all that with one needle, like what?
Yeah.
Of course you
Yeah.
did all these other needles, but I could tell that that was the one that was the one that needed to balance that side of my body.
Sure. Sure.
Now, in the traditional Chinese medicine that I've done, traditional in the sense of like what I've done, but
Mhm.
the needles are a little bit lighter to touch on the body.
Mhm. Mhm.
This one seems to be a little bit different.
Yeah.
I guess the question for me is why?
Well, okay, so we have to go back to the Tao Te Ching. So in the
Hmm.
Tao Te Ching, they say one begets two, two begets three, three begets 10,000 things. The way that we translate that into clinical practice is that one point should actually expand the yin and the yang. And then now, if you look at, like, for example, bowling pins, if you hit it just right, that one pin, it'll send the kinetic force to all the other pins, and then you will get a strike. So the idea is that first we look at your constitution. Once we know your constitution, we know exactly that pin that we're going to hit so that it will cascade to all of the other points in your body in conjunction with that therapeutic intervention for that moment. Because as you notice that I don't do the same point combination each time either.
No.
So I open up the body and then we adjust according to what's going on for that moment to get to your therapeutic type of response. Because each time that I open up a gate or open up a door in your body, we want to now push you past that particular milestone so that your body gets to the next point of destination in your overall journey. So you'll come in and you say, I want to accomplish this goal, Dr. Kamal. I said, okay, great. So now we will put together a therapeutic package that each time we're moving you steadily towards that goal so that you don't plateau.
Oh,
So that's
that's
difference.
steadily.
Yeah. Yeah, that's
That was like a
steadily.
that was like a rocket. Okay, so I was just like, hold on, I don't know if I was prepared for this.
Right,
Um,
right.
so
Yeah,
what you did was, which I've had this done before. Here's what I want to talk about. I've had
sure.
the electric, what's it called?
Electrostimulation, sure.
Electro stimulation
Yeah, electroacupuncture,
acupuncture
something. Yeah.
before.
Sure.
This is the first time where I was like, oh my gosh, what is happening? Like,
Right.
this is
Right.
so intense. And you're
Yeah.
like, are you kidding me? You're like on level one and there's
Yeah,
10
no, I had it.
levels.
It goes from the 1 to 10, and we only had it at one. But the difference here is that your body's more open.
Right.
And when your body's more open, everything's more sensitive. So I don't have to use too much amplitude on the
Mm,
stimulation machine because why? Your body is open and now the current is moving through and the frequency is doing what it needs to do. And then you're already more sensitive than most people. So
correct.
then that way I don't have to turn it up too much and
Okay.
don't have to leave it too long. And then you'll get the cascade response that even out of the office, you're
Mhm.
feeling it hours or days later. So that's really what the goal is.
Oh, I felt it for days later. Okay.
Yeah.
I was like, and I'm still like releasing, like you said, it'll be days. I'm
Right.
still releasing and I'm still, yeah, it was like a nice push. And the
Sure.
biggest part for me is the energy. You know, my thing was coming to you because of lack of energy, among other things. And I'm
Sure.
feeling a lot more energy. I'm feeling more balanced. Again, I'm like emotional roller coaster, but still in within that, I'm still feeling balanced, if that makes
But then
any
when we
sense.
remove that emotional baggage that you've been carrying that you forgot about, yeah?
Yeah.
Then now your body feels lighter, and then the translation becomes more energy, more motivation, and then you're encouraged to keep on the goal that you originally set out with me.
Right. Right. But speaking of baggage, the
Mhm,
interesting thing was for me, because again, this is not going to be everyone's experience, but for me, I
mhm.
can see different times. Yeah.
Yeah,
That's what
sure,
I do for a living.
sure,
I have a real estate brokerage and I also have a timeline regression hypnotherapy
sure,
practice. So
sure,
for me, it's very easy to like see things when it
sure,
comes to different times. And
sure.
so it was fascinating to me because in my work,
Hmm.
among many works in the energy world,
Hmm.
we look at a healing of when someone's experiencing something, we look at it as different times are also benefiting from this
Sure,
experience here today. And
sure,
so I really understood the meaning of that experience and those words that I know, but I didn't really understand them to be as true until I experienced my session with you this
sure.
last time, because I saw the scene and I was like, whoa, wait a minute. This just this is way back. This goes way
Yeah,
back.
yeah,
And this healed it all the way up to now. And so I thought,
sure.
wow, this is wonderful. This is beautiful. And this crosses through other lives and timelines for those who are prepared to
But
hear that.
just understand that anytime you connect with energy, think of it like corridors. So when
Mhm.
I was a kid, I my grandmother had these mirrors. So one big mirror, and then on the medicine cabinets had two big mirrors. So you could put the mirrors together, and it's like you could see into infinity.
Right.
So okay, so then now look at that as corridors. And each of the times that we align the mirrors just right, you could see forever. So,
Mhm.
what if I now change your frequency where you align in some way that you could see what you could see? And it's
Mhm.
just an alignment. So that's why I talk about the four energy alignment. That's why I always talking about alignment, because usually that misalignment is what's causing the energetic expression that is not beneficial.
Mhm.
Now, Western medicine, they call it disease. I don't call it disease, because what we do is we promote health. We just realign you and then allow the body to just recover.
Mhm.
So once we look at just different types of obstruction or misalignment, my job is only to realign you. And once you get that realignment, the body will know the rest of the story.
Right. Yeah. I mean, really amazing, your alignment. And then the energy, what do you call it? Where you're actually doing some sort of energy with your hands?
Okay, so it's just ionic rebalancing, because everybody is actually in connection with the environment. And
Mm-hmm.
so ions, whether positive or negative, we're bringing them in and releasing them all the time. So if we're
Mm-hmm.
bringing in oxygen, we're bringing in the negative ion. That's bonding to the positive ions in our red blood cell. Okay, so then now we're going through different types of ionic balancing and rebalancing. So once I do that particular non-needle intervention, now I can start doing things to create a realignment of your body, not just the physical body, but the ionic body. And so once I do that realignment, then what do you feel when you come off the table? Sometimes people feel lighter, they feel clearer, they feel like they just let weight off, or they just go to sleep and start snoring. And then
I
once they wake
felt
up, they feel different, you know. So yeah.
my experience with that was amazing. I think I've experienced it twice now that
Yeah.
you've done
Yeah.
it.
Hmm.
And it is energizing for me.
Yeah.
It feels like I don't know, like an energy field around me. Again,
Right. Yeah.
I'm very attuned to these energy shifts. You know, I don't know if everyone would understand that, but it was just like a complete dome of energy around. And you're
Right.
doing this with your hands, similar to if someone, I mean, just for people who don't understand, I don't want to
So
use this
that
word
some of the
loosely,
yeah, go ahead.
like Reiki, but it's not at all. It's
Yeah,
100%
so
not that. Yeah.
Rei and Rei in Japanese means fire. Ki
Mm-hmm.
is energy. Okay.
Mm-hmm.
So many people know about Reiki in the West, and then they also know about Qigong from China in the East. Okay. So I have studied those different types of systems, and then I incorporate those systems into the system that I'm using today, like I said, with the body type system and different aspects of that. So I have different lineages that I've studied over the years, and that's where I incorporate that into my specific style of practice, and that's why I call it ionic rebalancing, because I'm not doing anything new. I'm
Mm-hmm.
just realigning the body to what it already has been, will be, and continue to be ad infinitum. So many times, you know, if you get lost on the road, you just bring the traveler back on the path. Yeah. So that's really all I'm doing. It's just cleaning up what was going on and then sending you on your way. And then that way your body can do the rest. And that's why I call it ionic rebalancing. I don't call it Qigong. I don't call it external Qigong. I don't call it Reiki, or even people may be familiar with therapeutic touch
Mm-hmm.
uh, that some nurses and different people do. So the reason why is because we're changing the fields around the body, but realigning them so that they get rebalanced. So that's the only difference. And again,
Okay.
it's not anything new. It's something that the ancients would already do. It's just that I'm bringing it forward according to those particular, presets. Mhm.
Right. No, I absolutely love the sessions because I'm not sure, what is needed that day. And you have
Yeah.
so many different mixtures that you can do based on what energetically needs to be worked on. And so
Right.
this is what I love about your practice is that it's not just me coming in and having needles put in. I actually have the
Sure.
option of going with a session where you can incorporate many different, I don't want to call them modalities, but many different.
Yeah, we call it therapeutic interventions. And the reason why
Uh-huh.
I say that is because when you intervene somebody's path, you want like a therapeutic intervention is somebody's going off the cliff. So I grab you by the arm and make sure you don't go off. That's intervening.
Great analogy,
Okay.
Dr. Kamal.
Okay. So we want to make sure that you don't go in that direction that you're going
Mm,
that's going to cause other issues down the line. And that's what the ancient doctor would always do. Like one of my favorite doctors was Bien Che. Bien Che was very skilled in diagnosis.
mhm,
And one of the things that he would always do is report what he saw so that the person would avoid the impending calamity.
mhm,
So that's the idea for my particular practice is to make sure that if you're in a particular condition where you're already imbalanced, then I want to now rebalance you so that you avoid even a worse condition. You can start off with chills, and then you start off to the next level is fever,
mhm,
cough, then vomiting blood. What do we need to really go there? How about if I stop it at the chills?
mhm.
Okay, so that you don't have to experience all those other things, and then we avoid you having those type of energetic expressions that you really don't need to experience. You can hear about other people having that, but you don't necessarily have to have that.
Right. Okay. Understood. No,
Okay.
I do love the principles and I can see how you're running your practice so far. I really love it. And the experience has been out the roof. Like I said, I've had session, I think, on Monday,
Yeah.
and today is Saturday, and I'm still feeling it.
Yeah.
And it's Saturday. And I mean, that's powerful stuff,
And that's
really.
what we really want to be able to do is compound each session to the last session.
Right.
But many times people will experience a very profound change. Like, I was reading a story about back pain online today, and the guy said, oh, I feel back pain was eliminated in one session. But guess what? That was just a symptom. But then now, what about all the other alignment that that particular condition was causing for the connective tissue, for the misalignment of the spine, for all the different hydration issues of the discs. All of these things have to be realigned over time so
Hmm.
that a complete corrective condition can occur. And then now the person goes and enjoys their life. So
Right.
we don't want to just chase the symptoms. We call it in this kind of field chasing butterflies.
Right.
So you try
Yeah.
to get one butterfly, then one butterfly, then another butterfly, and then you're just chasing the symptoms as looking at the whole
Mhm.
of the butterflies at night. They go down and they rest because there's no sunlight. So then you can
Right.
just collect butterflies. You don't have to chase them.
Right. I actually want to bring something up. Like for example, as I discussed with you, I will not be able to come in this Monday, so
Yeah,
I'm
yeah,
going to be doing a remote session with you. So it'll be my
yeah,
first remote
yeah,
session that we'll be
yeah.
doing. In that situation, what will you be working with?
So the same thing is that when we're doing ionic rebalancing, then I call you, then I say, okay, I need you to be still. And then
Hmm.
you find a chair or you find a place to sit. And
Hmm.
then I do the same type of movements in that session that we would do in the office, but then now I'm guiding you through the breathing and I'm guiding you through the movement so that you can feel each aspect of what I'm doing. So
Got
the
it.
idea is that there is no real distance with energy. And so in the West, they understand quantum physics, they understand quantum entanglement. But in the ancients, this was normal understanding. Okay.
Hmm.
So whether we're doing an in-office visit or we're doing a remote session, it's actually the same because now I can still do all the different movements and then we guide and we work together so that we have that quantum entanglement and then you go about your day like you would normally go, and you're like, wow, I didn't have to travel 4 hours. He could just do it at this time and this day, and then we could work together, and then you can still get the benefit.
Can we discuss quantum entanglement lightly?
Hmm.
Now, the understanding in physics with quantum entanglement, are you
Yeah,
familiar with that?
yeah, definitely. Yeah. Which
Okay.
level would you like to talk about?
Well, I'd like to lightly touch about that because there's a reason I'm bringing it up, if you
Okay,
can.
sure, sure. So what part would you like to discuss? You open the floor and then we'll talk about that because
Okay.
from an ancient Chinese standpoint, we talk about it in different levels. Okay.
Hmm.
So they in the West know about one or two levels
Hmm.
currently on what they've discovered,
Right.
but then it can go into a whole other discussion altogether when we deal with certain types of lineages and different aspects like that. Yeah.
Can I hear the Chinese version?
Well, the idea is that there is no separation. Okay.
Hmm.
So the basic understanding is that um, once we connect with that specific person, once we connect with them, then we can start making adjustments
Hmm.
to their particular experience, meaning their life, the way that things are going on, either to their benefit or their detriment. So because
Wow.
it wasn't just our healing, okay?
Hmm.
There was also a martial aspect to this. So you have to understand in ancient times, you could go one way or the other. So the idea is that there were certain groups that, like of my particular lineage, that we use it only for virtues. And we make sure that we cultivate virtues so that we're not doing it for malevolent purposes. And
Okay.
if people are doing it for that, then we actually know how to correct it.
Oh, interesting.
Yeah.
Okay.
Yeah.
All
So
right.
that's our goal is to always be supportive, not have any judgment, not have any attachment, but oh, is this is what you're experiencing? Okay, then we clean you up, correct it, and then now you can move back onto your path.
Got it.
Yeah.
Okay. Understood. Very
Yeah.
good. Okay.
So that's from our point of view, but from science right now, there's, observing different types of molecules and different things and how they can be in the same space and same time, and there's no distance, and they can see different aspects of that entanglement, and that's what their definition is.
Right. Which in a way is kind of similar, but you're going in with a specific intention and the awareness of being able to shift it while you by entering into this quantum entanglement and saying, okay, we can
Yeah.
shift this here, balance you, and you're better.
Right. So it just for our standpoint, we're looking at it from an examination. And
Right.
once we do an examination, we diagnose what's happening,
Hmm.
and then we make the correction in accordance to what's needed at that moment. That's why I said when somebody comes into my office, it's always what's needed at that moment. Because yes, let's say you're coming in for a headache. I see the headache, but then you also may have a slight fever that
Right.
is incorporated in. So maybe it's, 99 .8 or something like that. Okay. So I need to address those issues because all of those are incorporated with it. So that's the idea. Okay.
Right.
Yeah.
Okay. Understood.
So let me just get out of the sun just a little bit here. So yeah.
Yeah.
Yeah. All right.
Okay.
Okay. Yeah.
Perfect. All right. Well, that is very interesting, Dr. Kamal. I was so excited to get you on today to discuss this new offices that you started. Not started. They were um,
Well,
uh,
that yeah. So one of my teachers, like I said, she finally got a chance to retire after 42 years. Another teacher after 26 years. So the idea is that I just want to continue in their legacy. We're under a different name, but the first teacher actually sent me to Chinese medicine school 30 years ago. So, I
wow,
mean, so this is just me just giving back and lending my experience just to her patient population. Because she says, I don't want to retire if I don't have anybody that can help my patients. I said, oh, I'll come and help your patients. That's easy, no problem.
beautiful. Beautiful,
Mhm.
exciting. Guys, if you're watching this video, if you make it to Florida, definitely stop over at Dr. Kamal's to experience this lovely acupuncture and more
Yeah.
because it
So,
is a
and then
lot
also
more.
too, if people are doing a comprehensive exam, we still do the virtual sessions like we did in a host seminars if they got body type. But then now we extend some of the other things that we do as well, because I can prescribe herbal therapy or do the ionic rebalancing like you're going to experience on Monday, or different things like that now.
Right, exactly, virtually. Perfect.
Yeah.
All
Yeah.
right, very amazing. I'm so excited for you and your journey, and for those that get to experience a wonderful session with you. And I look forward to my appointment on Monday, and then I can report back as to how that was.
Yeah, yeah,
So I'm
yeah.
pretty excited.
It's very strange for people to feel it for the first time, but you'll be pretty good and
Oh,
descriptive and
I'm,
things,
oh
you
yeah,
know.
I'm
Yeah,
totally open and used to having distance
sure.
work and sessions, but there's something about your work that's something it's completely out of this world, literally. It's very intense, very powerful, probably the most
Mm.
powerful I've experienced ever.
Oh, okay.
And so, and I've done so many out there.
Yeah,
Like, I
yeah,
mean,
yeah. Well, that's
I
it.
can't even
Also,
count.
too, you have to also look at the lineage because remember, it's not just me, it's all the teachers that I'm connected to over the years. That this is when I tell people, okay, when they feel my tuina, okay, that's just me mimicking my teacher. So they're getting the benefit of the experience of all the teachers in our lineage at that time because I'm just mimicking the person that taught me. So when you're getting a remote session, you're getting the benefit of all of those teachers that are in our lineage. So just understand that.
Isn't that beautiful? That is so beautiful. I love it. All right. Well, thank you, Dr. Kamal. I appreciate you taking some time out of your day today, and thank you for everything that you do. I will
You're
have
welcome.
I will have Dr. Kamal's information below the video for those of you that are interested in booking a session with him. Thank you.
All right. Hope to see you guys soon.